This is Dr. Bev Knox, and you are listening to my psychology tutorials. Learn psychology while you sleep.
Retirement, the exit from the paid labor force, is a recent phenomenon. Historians point out that in colonial America, many people worked well past the age of 65. Men in their 70s hauled grain, transported rugs, and tanned leather. One man still worked in the coal mines at age 102. Those over age 65 who were in government positions, such as governors and their assistants, or were ministers who typically retained their offices until death, and some women worked as midwives well into their 70s. Anthropologist Margaret Mead once said, "Sooner or later I'm going to die, but I'm not going to retire." True to her word, Mead authored and co-authored several books before she died at age 77. Like Mead, many people work until they die. In 2004, 19% of men and 11% of women aged 65 and over were in the labor force. What many people don't realize is that many of these elderly employees are working full time. More so, the percentage of workers over 65 have increased considerably since 1995, especially for women. The poverty rate for Americans aged 65 and older dropped from 35% in 1959 to under 10% in 2004. This proportion is now probably lower than that of any other age group, including children. Why then are so many older Americans working well past the age of 65, either full-time or part-time? Some of these reasons include the following: Social Security. A public retirement pension system administered by the federal government provides income to more than 90% of the elderly, but the benefits depend on how long people have been in the labor force and how much they have earned. Because Social Security replaces only 39% of the average older person's pre-retirement income, many must continue to work. In 2000, the Social Security Administration eliminated penalties for working after the age of 65. Because people who reached their designated retirement age would receive full Social Security payments, whether they were employed or not, many worked to supplement their income. The rapid growth of healthcare costs since the late 1990s led to reductions in employers' coverage of retirees, providing an incentive for older employees to work as long as possible. Since the early 1990s, many companies, especially in steel, airline, and auto industries, have reduced or eliminated their employee pension plans. As a result, many older people, including baby boomers, plan to continue working indefinitely. Only 27% of workers age 40 and older and 50% age 65 feel confident that they will have enough money to live comfortably after they retire. And in all age groups from age 18 to 65 and older, about 48% worry that they won't be able to pay for medical costs after retirement. Such concerns are incentives for working as long as possible.